This is actually a video that we're gonna take. Okay, good morning. We are having an early service today on customer service. Customer service is one of those where you need at least one before you renew your certification. Okay, so this is good. This is the reason why we try to have this. Okay, it's important we have good customer service here in our facility because it affects everybody, not only your coworker. But it signifies that we are able to communicate with family members. With hi, just go ahead and say it. Angelica, right?
Yes.
Yeah. So we're having a service, and today we're doing on customer service. Okay. And once or twice a week, I have these services, and you build your CEUs. I knew you were gonna do that, and you can use it to renew your certification. Okay. All right. So I was just saying how important customer service is, because not only you're building communication and relationship with your resident, but also you're able to communicate with your coworker. In this little piece of paper here, and the reason why also your relationship with your coworker is important is because of the amount of time we spend here. Okay, even if you just work part-time here, you're working 8 hours a day. You know, can you imagine coming to work, being in an environment where it is toxic? And nobody wants to be in that environment. And you can avoid having toxic environment by basically just saying to your coworker, you know, hey, how you doing? You know, you want me to help you with anything? Even just smiling to vendors, it resonate a very positive impact, right? And try to figure out your resident and how to communicate with them is going to be really important. And I'll go over some of that stuff in here. But I'll go over some of the things too that was emailed to me by I was emailed this from one of the admin. Okay, I'm gonna read this out to people. Okay, and this is why I always say Seacrest is one of the best, and this is one of the few that I'm sharing. But a lot of the people that come here from like registry, you know, they're like, hey, you know, you guys have a really good facility. You guys work really well together. But this is and I shared this, I think, in our text with everybody. So this is a CNA that comes from the North Coast Hospice. She's been a CNA since 1989, and so she's seen a lot of skilled nursing. You know, she's been around, and I was a CNA for 4 years, and I've seen a lot of skilled nursing. I was an LVN for about 5 or 6 years, and I go to some of these skilled nursing, and I go over to some of the nurses, and I try to get information on a resident, and they pretend like they don't even see you. And that's how bad it is sometimes. You're going into some of these skilled nursing where they have the earphones on, they're just talking to themselves, and you're trying to talk to them, trying to get information, and they don't see you. They don't see you at all. I mean, the communication and the disrespect, I think, in some of these skilled nursing is crazy to me. And the customer service is just really not there. I mean, because there's really nobody there overlooking them. Like, hey, you know what? When people come in, you should probably talk to them and see what they need, if they need help. But some of these skilled nursing, and I know this is on video, but I'm gonna call them out. You know, some of these skilled nursing in Escondido is rough. You know, and so they don't know how to
because of this. People
So
always in the cell phone all the time.
yeah, right. And they're just like they have a sense of like, oh yeah, that's your resident. You come in here, you figure out your own. And they don't really want to talk to you. And these are vendors. I'm coming in as a vendor, as a hospice nurse, trying to get information. And I'm being looked at like, you know, like an outsider, like, hey, so who's this guy? You want information, go get it on your own. But I see all the time, I walk into a skilled nursing and people are just kind of like, you know, listening to music. There's, you know, it's not a working environment. But that equals to like pretty toxic and some of the, you know, if you're not in that clique, like, you know, it becomes pretty toxic. Because I've been in those type of skilled nursing, you know, and I don't ever want us to be in that situation. I want us to, like, you know, greet family members. I want us to greet our coworkers. As I mentioned before, some of us are going through some difficult situation, and when we may come to work with a big smile, you know, but and we know how to hide stuff. You know, human beings know how to hide stuff, right? We know how to separate our work from our personal life. So when we come to work, and many of us maybe be going through a lot of stuff, you know, and none of us in here know that, you know, but a simple say, hey, how you doing out there? You know, can I help you with something? Or just saying hi to people is going to make a big impact, you know, a positive impact. And so if you're working 40 hours a week, full time, right? I have some numbers in here. That's a long time. That's 1,920 hours a year that you're spending, or 80 days a year total, you know. And so if you're working in an environment where it's toxic and you're spending that much amount of time, you're gonna either arguing with your coworker, you're gonna either hate coming to work, you know, and you have to pay your bills, right? You know, or you're just gonna quit. You're just like, I can't handle it, you know, or you're gonna take it out on your resident. You know what I mean? So I always encourage people, if you're not feeling, you know, treated fairly, you know, if people are disrespecting you, come to me. You know, we'll sit down, we'll talk about it. But a lot of times it's just communication. You know, sitting people down and figuring out what are the grudges. You know, a lot of times it's misunderstanding. You know, a lot of times it's the way you communicate. You know, is your verb, is your tone, right? Is your body language. And I just want to be different. We're a 5-star facility. We want to continue to be a 5-star facility. That includes our staffing, includes infection, the way we treat infection, but also just our customer service, right? And we want to continue to stand out and different from all the skilled nursing out there. You know, I want people to come in and be like, oh yeah, they're different. And so this right here, basically, this CNA came in, and she comes in here quite frequently, and she's been a CNA since 1989. You know, and that's a long time to be a CNA, seeing all kinds of skilled nursing. And then she says, you know, I wanted to pass along the information from, this is from HR.
Joy?
She said that, this is, what's her name? No, this is Allison, who said that she has been coming here for a few weeks and is just astounded by the amazing staff in GHC. She said that she's been working as a CNA since 1989 and has never seen staff work together so well, but also a team that she never has to ask for help because we're just readily available to help people. So she's really impressed, and I've seen this many times when people come in from like a registry. You know, a lot of times I've worked in registry too. I've signed up as a registry way in the past. You know, I've been in nursing for like 20 something years, right? And I've worked in registry before, and you come in, you're just like, nobody wants to tell you anything, right? And I have, you know, 12, 15 residents in the middle of the night, and I'm trying to figure out how this resident, I was like, oh, here's census, you can figure it out on your own, you know? And because, you know, each person has their own thing, and nobody really wants to take a time to kind of like orient you. But here at Seacrest, we have like a dedicated person, you know, like the clerks a lot of time will try to help you, you know, or RNAs will try to help you and say, hey, these are your resident if you're a registry. And so that's how we are a little bit more different, because we've gone through so many things, right? And we kind of know how to deal with people, how to deal with those kind of situations. Okay, all right. So that's really customer service in a nutshell in terms of you know, your coworkers and also like vendors. Okay. Now, important to include now patient and family members, how to communicate to family members. It's important to include all members of the patient, creating a comfort zone between you and family. So when you're dealing with a resident and you're trying to communicate a change of condition or something like that, it's really important to call family. Hey, this is what's going on. And some of the things you might want to share with them is that you know your loved one is eating good, is participating well, is communicating well. They want to hear and see that. You know, the skin looks pretty good. I don't see any new changes. Are they having any pain? Are they comfortable? Those are certain things that you can share with them. You know, their hair looks good today. I did her hair. You know, a lot of times the CNA may feel like, hey, what am I going to communicate with you know the family members? But it's easy. How are they feeling, right? Like, what did you do for them? Are they eating? Are they doing activities? Are they having any pain? You know, maybe they're not sleeping. You can communicate all of that. You know, if you're not sure how to communicate and what to communicate with family members, you should probably just give it to your supervisor, okay? And you can always say that too, like, hey, this is what's going on with the resident, you know, because I'm taking care of it. In my view, as a CNA. Now, the LVNs might have different view. You know, they might have labs that indicate, hey, she's not doing well. And you're reporting, oh, she's doing really well, you know? But you can always add, you know what, you know, this is how she's doing based on, you know, as a CNA. And then you might want to contact the LVN, though, to get, you know, how she's doing overall. because the LVN has a different view. Sometimes that gets kind of like iffy because we're reporting one thing as a CNA, and then the LVN is reporting a different like reporting, but it's totally, they're looking at it in a different manner. Okay. Residents may defer communicating with their needs if they are feeling depressed or lonely. Okay, so if they're not comfortable with you, they may not necessarily be communicating everything with you, right? So if they're having pain, right, that day, they might not communicate that with you. So it's really up to the CNA and the staff to be able to communicate with these residents efficiently and effectively, to have that good relationship with the resident. And how do we get that like comfort zone between us and the resident? If you treat the resident with respect and dignity, you're gonna get that level of relationship with your resident. So just having the respect with the resident and treating them with dignity is going to be really important in terms of trying to communicate with them. But residents may have they also might have hearing issues or vision issues, and so with these residents, there's a technique that we use as nurses when we're communicating is really kind of sit down eye level. You don't want to be looking down at the resident and talking to them, because if they have a hearing issue or vision issue, they're gonna have a very difficult time trying to understand you. Also saying it slowly, not necessarily loud, because they're not deaf. Okay, a resident who has dementia.
I cannot understand.
Yeah. So, or maybe
Yeah.
pull down your mask a little bit, but if it's safe to do so, right? Right, in an isolated room. But sitting down and then slowing down your speech, because they have a difficulty of like understanding what you're saying, but they don't have they may not have issue with hearing. In this situation, they do have issue with hearing. So slowing it down, your phrases, is going to be really important. Okay, and then maybe cleaning the glasses, giving them the glasses, cleaning the hearing aid, putting new batteries. Those are all going to be really important in trying to communicate with your residents. Okay. So those are things that could be a barrier when you're trying to communicate with your resident. Also, we talked about this a couple weeks ago when we had in-service on dementia, is that resident who has progressive dementia or Alzheimer's, they may not necessarily remember the events that occurred, but they're gonna remember all the feelings and emotions that are attached to that event. Okay, so if you mention something that kind of pissed off that resident or triggered them, and they're now feeling lonely or depressed or angry, the next shift they're not gonna be able to basically say, hey, this is what happened, but they are gonna have those feelings of anger towards the next shift, right? So it's important to kind of remember that when you're taking care of these residents and you're trying to communicate, that these residents might have these feelings of depression or anger or loneliness or whatever it is, anxiety, from the previous shift, maybe because they were triggered. Okay. Allowing residents to talk, express themselves, and providing good listening skills is a great way to really communicate with these residents. So listen to the resident, they're oriented, listen to what they're saying, allow them to complete their sentences. Don't jump the gun and be like, oh yeah, I know, let's do this and do that. So allow them to express themselves, and so you can follow through on their request. Okay, and always end like your communication to the resident. What else can I do for you? Is there anything else I can do for you? Before you kind of run off. A lot of times the complaints that we have is that the resident was like, hey, you know what? And we are working really fast because that's our nature. We have 8 residents. We have an hour and a half to get them to breakfast. We have to work quickly. So a lot of times it feels like the resident is going slow, and they are. And but we can communicate by saying, what else can I do for you, Mrs. Brown, or whatever, before I leave. Okay. Do that already. All right, so let's go over orientation and how to get orientation with resident. When you have a new admin and you're trying to figure out how am I going to communicate with this resident, and how do I even know if they're oriented or confused, right? Let's just say that you're busy, or maybe you're registering, you're not getting the report that you need, right? So you go into a room and you're trying to figure out, okay, is this resident oriented or not? What are some main things that we need to do in terms of orientation? How do we get orientation of residents? How do we figure that out? They're orient times 1, 2, 3, or 4. Are they confused, or are they all there mentally, right? How do we do that? After we had this in service, Johnny, Alma,
Trying to, okay.
huh?
No, I'm trying to count what I need to say about what we need to say about orientation. You asking us if we can give us examples of how do you orientate new patient. So
How do you know that they're? How do you know if they're not confused?
what
What kind of communication do you gotta make? What kind of questions do you gotta be asking them?
number one, his name.
Okay, okay, what are you saying?
Number one, the patient's name.
Okay, you ask the patients their name.
Yeah,
Okay,
Patient's name.
okay, and then what are you
Yeah.
looking for in their name? Like, let's say their name is like, you know, Joe whatever, Joe Brown, and they say, hey, I don't know, and they don't say I don't know.
Well, if they,
What does that tell you?
If they cannot pronounce their name that right, like you say, okay, my name Joe. I mean, his name is Joe,
Okay,
and now say something different.
yeah. What does that tell you?
That tells that you're not saying something right.
He's not oriented, right? Okay.
Yes.
Okay, that's good. That's good. That is what are they oriented to their name, right? What's the other one?
But if that is not right, what she is saying, Joe, but her name is not Joe.
And then they're
you need
confused.
to-
Then they're
yeah,
confused. Then they're
You need
confused.
to-
Or it might be
Oh.
the wrong resident. Well, no, not really, because you're asking them, right? You're asking them their name. You're not telling them their name.
Uh-huh.
You
What's
asking
your
them
name? They're gonna
right.
tell you.
Uh-huh.
Okay.
And
So
then-
he's right. If they say the wrong name, or if they're not even saying their name, they're likely not confused. But that's not where it stopped, right? There's a couple questions you need to keep asking. Keep going, Johnny.
If the patient know where they are, do you know where you are now?
Very good, right? Look at Johnny, man. He's on a roll, right?
You
Location.
will be the board.
If they're a new if they say, I'm at Seacrest, I'm here for a rehab, they're oriented, right? If they say, I don't know, I mean, whatever, Alabama or something like that, right? Or they say they don't know, right? You want to put that in the back of your mind. They're not oriented. Not only they're not oriented, right now they're oriented to their name and location. What else do we ask for? This is very good because now you're like getting a good view. Like, okay,
But
you
most
know,
of them,
they know exactly where they're at, right? And especially if they say rehab, right? Okay, what else are we looking for?
the month, the year.
Right? If they know the
days
month
the
of the
day.
year, right? And then you don't have to like just say, hey, I'm asking this question because I'm trying to build these communication with you. Can you tell me what the month is or the year? And it doesn't have to be exact, guys. And sometimes, you know what, they got out of the hospital just because they missed it by 1 or 2 days or by 1 month. It doesn't mean that they're confused. It's likely they probably get been operated on and they've been in bed for a month and they might have missed it.
Right.
But if they say, hey, it's 1989 or whatever, okay, they're confused. Okay, if they say, hey, it's 2024 and it's the month of March, 25, but it's actually April 1st, they're oriented. That means they know where they're at. They know their name. They know the dates. What else are we looking for? Situation. Situation. What are you here for? If they say I'm here because I don't know why I'm here. I'm here because they forced me here. They forced me here, and I want to go home. They're confused. If they're here to say, hey, you know what? I fell down and broke my hip. Those 4 things right there tells you that you need to be communicating with your resident in an efficient manner. Once you know that they know their name, they know where they're at. They know the reason why they're here. They know you can even ask the president. If they say close to it, like Barack Obama, there may be some confusion there. But if they say, Donald Trump, that might still be close. Biden, obviously these residents, if they're oriented, they're watching the news all the time. Whether they're Democrats or Republican, they're gonna know the president. Okay? So those are important too. But knowing all of those will tell you how to communicate with residents. If they're not oriented to any of those, I don't know, they're just like shaking their head. I'm here. I don't even know if they're forcing me. I want to go home. Blah, blah, blah.
Most of your
So
residents.
it doesn't mean that your communication kind of just falls apart and you're gonna just do everything on the for them. You still have to tell them like, this is what I'm gonna do. Mr. Brown, okay, do this and that. But obviously, that's a big part of your communication, right? If the patient is oriented times 4 in comparison to somebody who's confused, a lot of times you kind of just like, you need to make a decision for that resident as you're caring for them, right? We're gonna transfer you, right? You're just communicating, this is what I'm gonna do for you, okay? Or you might get some help. But if they're oriented, you're gonna have to wait for that resident's, request. So that's gonna be really important. That's either gonna break you or make you right there. Those communication between you and resident, knowing whether they're oriented or not, and then the way you communicate with them, a lot of times is gonna either make you or break you that shift. You know what I mean? She's either gonna say you're great or man, this person is horrible. You know, never listened to me, just did everything on their own. And you're thinking that, oh, okay, she's not talking, so she's probably confused, but you never did that assessment. Or if you can't do the assessment, you can always talk to the nurses. Okay, and the reason why I teach our CNAs how to do orientation is because sometimes nurses may not be able to do it, and you need to go in there. And these are simple communication that you just kind of like, you know, simple talk with your resident. That'll give you very critical information on how to care for your resident. And knowing that they're oriented, you can even ask, well, what are you here for? You know, what can we do? What were you doing in the hospital? But if they're confused, you're not gonna be able to ask that, right? You're gonna have to like really rely on your on your nurses. But think about how important that is when you're communicating with your resident. Okay. All right. So those are important steps to having good customer service. Not only you're communicating with your coworker, saying, you know, how you doing, you know, can I help you with anything? The vendors, family members, just saying hi to them. You know, simple hi. You know, it separates us from a ghetto facility in Escondido. I'm gonna keep calling it Escondido because I've been working there forever. Compared to a facility like us, where we always, you know, we want to address people. You know, I used to live in Escondido, and I work in a lot of skilled nursing there, and it's rough there, man. It's rough. There's a clique. If you're not part of the clique, you're just, unfortunately, you're gonna be in the corner, and you either like it, or and you stay there, or you go away. And a lot of them, I just kind of like, this is not a place for me. So, but we want to be different, right? We want to help our coworker out. We want to address the vendors when they're coming in. And then family members, obviously, but resident, we need to know our resident in terms of orientation. Okay, but these are simple things that separates us from other skilled nursing, good customer service. But also, you make an impact on your coworker. You know how you communicate. You remember, because you're here. If I'm working full time with you, and we both have the same run, I'm here 80 hours with you. I gotta get along with you. Now, I don't have to be your best friend, but we gotta be able to communicate. You know what I mean? Because we're spending a lot of time together. You know what I mean? 8 hours a day. I mean, I think that's more time than I spend with my wife a lot of times, right? So that it's really important to have that good communication between you and your coworker. Again, it doesn't have to be your best friend, but you guys should be able to communicate, you know, together. Let's go over the test real quick. Any questions? Make sure you guys are signing in. Okay.
But Jen, she's far away there, and
She wants to communicate with you, Johnny. Okay.
I said, John, what?
This is why I tell you guys to use radio at night.
Because we are only 3 at night.
It's 3. Okay. All right, guys. What are the 4 levels of orientation? Person, time, place, situation. Okay. Person, time, place, situation is the answer for question 1. Okay. Question 2. Oh, here's a your pen. There you go. So person, time, place, situation. Okay. Those are levels of orientation. Examples of questions to determine orientation. What are some of the questions we're gonna ask them? Right? What time? The time and date. Right? You're gonna ask them their name. You can ask them why they are here. Right?
What example of question determining orientation?
So, where are you at is another one. Person, time, place, situation.
Okay.
and so the questions for those, basically, you're just trying to figure out and to know where they're at. You know, where are you at? Their name. You want to ask for the date, right? All right. And then at the bottom, guys, let's go over this real quickly. Resident who's feeling isolated or depressed may not report pain or feeling depression. That's true. Some resident who does not adjust well to a new environment, like new admits, may feel abandoned and or anxious. Okay, that's true.
Number 1.
1 and 2 is true.
Yeah.
Treating residents with dignity and respect is one way to build trust. That's true. And then allowing residents to talk, having empathy and understanding is a good way to communicate with residents. Yes, that's true. Right. Ate, number 5. Identify the best way to communicate with residents who has hearing impairment.
Identify yourself by name. Speak slowly and clearly. Okay?
And then there's also C, use gestures, point objects, right? You can use that. D, repeat yourself or restate your phrase if resident continues to exhibit difficulty understanding you. And then, or E, I think we're gonna use E here. Okay, number 5. Those are all. Number 5, there's E right there.
Okay.
So those are all examples of pretty good way to kind of communicate with your resident who might have hearing impairment. This way to communicate with a patient who has vision impairment. Johnny, you're doing so well, man. Keep going. Number 6, turn your page around. These are residents who have vision impairment. How do you communicate with them?
Vision impairment. Position yourself.
Position yourself where the resident can see you, right?
Right,
Best,
right.
right? That's a good way. So that's definitely A is good. What about B? Identify yourself by name. If resident has glasses, make sure that he or she has them on and the lenses are clean. We talked about that slightly just now, right? That's a good one too. Use touch and talk to resident frequently so that the resident knows what you are doing. So I don't know about C, okay? Because a lot of times we want to try to avoid touching resident unless you really, really know the resident. So if you're just coming in with resident, I mean, you can talk to resident frequently so that resident knows what you are doing. You can certainly like tell the resident that this is what you're going to be doing, but I will try to avoid like the touching part because a lot of times if they're kind of like already like a little anxious,
Right.
if they're not comfortable with you, the touching part might be a little intrusive a little bit. Okay, so A and B, I will definitely use that as a way to communicate with a resident who has vision impairment. And then obviously you are gonna explain to the resident, this is what I'm gonna be doing. For example, if they're eating lunch or whatever and they can't see what's on their plate, you can use the clock. This is 12 o'clock. There's potatoes and all that. All right, let's go to 8. True or false? Most resident want to socialize as this is a way for them to ease their loneliness. So that's gonna be false, guys. Most residents who have some form of depression or loneliness, they don't really want to socialize. It's our job to really trigger these residents and get them to do things. Okay.
7.
What about
7.
showing compassion? Yes, that's true. Showing compassion and concern can help deter isolation for new admitted residents. Okay, that's true. Sorry. And 9. Name ways to greet family the correct ways. Okay, greet them warmly and politely. Speak to them about their loved one, I guess, is doing. Share your observation about residents' progress. Okay, we really do E, right? They like to hear about how their loved ones are doing. Okay, and so just be careful about certain things, and the patient might be declining, and you're saying the patient is doing really well. That could be a little that might cause some issues with the nurses up front, because they might be communicating in one way. So definitely though, like communicate what you see, right, and what you did for that resident. True or false? Questions you can't answer from family members should be referred to your supervisor. That's true. And then what and how should I report family about their loved ones? And this is probably all the above here. Eating well, attending activities, mood, like if there are any mood issues, active or non-active, how residents look like, all that stuff, right? True or false? A simple hello or smile, families, vendors, coworkers can prevent toxic environment, probably in here. That's true. Okay. All right. Any questions on? Yeah. So you're basically asking who they are, right? Asking questions. Person. Who? What's their name? What's your name? Time. Do you know the date, sir? Right. These are questions that you would be asking the resident. Situation. Why are you here? Right. And in place, where are you at? Right. So, but I'm trying to like give you a way to communicate with your resident and how to ask them questions, right? All right. Any questions on that? Yeah, that's it. All right.